Hi, I'm Rachel Simmons. I'm the Internal Medicine Residency Program Director.
And hi, I'm Jennifer Jeremiah. I'm an Associate Residency Program Director and a Clinician Educator.
So to me, I think for many relationships, some investment in setting up the relationship and maintaining the relationship often pays great dividends and allows for you to get the most out of working with other people. So I think being thoughtful about how one approaches a mentorship relationship is important.
And to me, mentors are just so important, whether you're in clinical work or in academic work. There's somebody for a listening ear. Someone can guide you along the pathway to get to where you want to be, provide you with advice along the way, and really just help you be successful in whatever it is you want to do.
So I honestly think one of the first things I think about is that sometimes we have the conception that there is the mentor. I actually think it's much more important to think about like a slate of mentors where you may be going to different people for different things. So I think just bear that in mind. Sometimes we think about there's this one, sometimes magical or mythical mentor. I really want you to think about multiple. And when I think about mentoring relationships and about to meet with a mentor, I think about the ways that this, what is it that I am seeking help with? What is it that, I feel like would be important to discuss with this person? And I think it's worthwhile thinking about what would be most useful now and how I would structure that conversation with the person, as well as like sometimes setting up your first meeting with a mentor is also a getting to know you experience. So both for you and them.
I agree. I think it really has to do with what it is that you need help and support with. In the clinical world, having mentors, I think, is so important, especially when you start out. There's so many challenges in clinical medicine in terms of uncertainty, challenges with patients, challenges with the fact that we don't know everything, worrying about making mistakes, and having someone more senior to help you, to support you, make you realize that we're not perfect. We're going to make mistakes and we can get help and seek support. And I think that's really important. I think in the academic world, your goals are going to be different. They may change and you'll pick your mentors based on what those goals are. If it's to be able to progress in the academic world, choosing someone who can help you achieve those things. One piece of advice I give to people is if it's, especially in academics, if you are thinking of where you want to go in scholarly work, in promotions, is finding someone senior who can give you their past experiences and someone who's already there, so they're not competing with you for opportunities. They want to provide you opportunities, connect you with others, help lead you that way.
I do think considering goals and also timeline, I think is really helpful. So for example, if there are residents who are thinking about, their plans after residency, that's a pretty clear timeline, whether it's pursuing a subspecialty fellowship or beginning to work in their first position as a practicing physician. And so I think that can be really helpful in setting goals. And I think also for junior faculty, thinking about, this is my first year, this is my third year, I've gotten, maybe I've gotten my feet wet, and now I really want to think about what are my next sort of short and medium and long-term goals, and I'd like to talk through those with someone. I think those are a real great place to start in thinking about what one wants to get out of the relationship. I think when you decide what you want to get out of the relationship, I think self-reflection about having a topic and getting feedback on something to walk in with can be very helpful.
Absolutely. I agree. Determining what it is you're passionate about and having that in mind, they may be better equipped to help you with the steps, although I think coming prepared of what your strengths are, what you want to work on, they can help build and support that. But if they know your passions, they can help create a pathway for you to pursue. I think a true mentor is someone that you connect with, who is ready to be your champion, ready to support and guide you, correct you, give you feedback, even if sometimes it's not what you want to hear, but their ultimate goal is to help you progress, achieve what you want. And so sometimes it may be finding somebody who may not connect, or they may not be able to help you with what you really need initially, or you may find new passions and need somebody else who has different experiences to support you.
You can absolutely change mentors, and you should change mentors if your goals change, or if for whatever reason that mentoring relationship is not working out for either of you. It does no one good to continue pursuing a relationship that's not productive for either of you. So yes, you can absolutely change mentors. And sometimes people find that they were perhaps interested in one career path, they wanted to change directions. There are times for like clinician educators where maybe they were working with one group of learners and now want to shift to a different group of learners. And so that may change sort of their next mentoring relationship. So yeah, that happens. I would say that even in people who you are close mentors, who become your close mentors, there are times in your career where they will be more or less involved, even in people who you are really close to. And that is a natural ebb and flow of work. I think people often have multiple mentors. I think I think that you can think about mentors in terms of specific spheres of your professional work. So for example, if you are let's say a clinician educator, you might have someone who you really admire their teaching and want to work with them on academic projects around teaching. There may be people that you really admire their actual clinical work with patients and want them to mentor you in things like patient experience and really bringing the most to the bedside. I have someone in my life who I think does a fantastic job of integrating both work and life, and I feel like he's one of my mentors in that realm. So I think, I think considering that there are maybe multiple people that you may come to really respect and want to have their sort of be in a mentoring relationship with them around different aspects of your professional life is I think pretty normal.
Oh, absolutely. I think that is the role of a mentor, to be able to connect people, again, to support you in where you want to go. One sort of side piece of advice I have from my own experiences is sometimes you need to say yes to something you might not think is in your wheelhouse, and that might mean connecting with a different person. The mentor should be able to help you also when to say yes and when to say no. There are some no's that might be important for you, but I do encourage people to say yes sometimes, even if it's not something they were thinking, because the connections that come from that can help you on your pathway, and you might find new passions along the way. But by working with someone who you weren't in an area you may not have thought was for you, may open up doors to opportunities that open doors to new opportunities. That's something I really experienced and really encourage people to be open to.
I think there's a few things that can be really helpful as a mentee in a mentoring relationship. One, I do think doing preparation for meetings and for the relationship. So taking that time to self-reflect, like using people's time effectively when there are issues brought up at the meeting, things to do, or over email, to be accountable and do those things, to follow up. And we all know that there are times where we get busy, but to be transparent and communicate about those busy times. Like I don't think there are many mentors out there who, if you communicate, I am working on this, it's a really busy time over the next X weeks or months, I'm gonna get back to you on this date. I think people respond well to that sort of back and forth communication. I think accountability is really helpful too. I think as a mentee, you want to take it upon yourself as a responsibility for some of those communication and scheduling things, and to ask your mentors, like, what are the ways that you prefer to communicate? Like how can we connect best?
I don't have much to add to that either. I do think the mentee needs to come equipped with some specifics and be ready to get feedback on them. Again, the mentor can certainly guide you, give you ideas, But if something comes from within, it's more likely to be something you want to pursue. But again, you have to be open to their guidance. They have the expertise for you. I also think that scheduling is really important because it holds you accountable, makes you honest. So I am meeting with my mentor in 4 weeks, and we talked about getting this done. I am going to make sure it is done beforehand. So I think that really helps you stay on track by taking that ownership of when we meet and what we're going to talk about.
I think there's a lot of opportunities in some great national organizations or even regional that have mentorship programs where they will pair you. And I think this can be really helpful to widen your circle. And so I think if there are organizations that offer that, I would consider doing it. I know I've met some interesting people along the way, and it just also helps broaden your sphere. And I think no matter what field you go into, you'll often find that a lot of the challenges you face are also being faced by other people across the country, or some of the most important questions that we want to answer or attend to, are often questions being asked by others too. So I would think about sort of looking beyond your institution. And I think one of the ways to do that is through national organizations. And for residents and students, there are often sort of resident and student sections of national organizations and national meetings, which may be a great place to get to know people and meet others.
No, I absolutely agree. That's advice that I often give my advisees, is to join the organizations that represent where you see yourself, get an opportunity to meet people early, collaborate early, and that'll help you.
I will say, if you're going to do things with a national or regional organization, you want to make sure that you deliver on whatever you commit to, because this is how they are getting to know you. So you just want to make sure that whatever you have agreed to, you bring, enthusiasm, you bring accountability, you bring a great, showcase of what you can do. Absolutely. I think both Jen and I would agree that the mentor-mentee relationship on both sides can be one of the most rewarding of our careers in medicine. And so we thank you for taking the time out to listen about, being a mentee. And we feel like this has been one of my great joys working in medicine, is to be both a mentor and a mentee.
Sometimes people will be hesitant to reach out to somebody. That's been expressed to me. And I think it's really important to recognize, as Rachel said, mentors really value that opportunity. They enjoy it. They want to do it. So don't ever hesitate to reach out. You'll find that the majority of people are there to support you and want to help you.